So I've been asked to present to you guys here today on the guide that my organization developed on navigating the mental health system. And just a little bit of a background. We're Schizophrenia Society of Ontario. We're a provincial organization, so our mandate is all of Ontario. And we provide a number of support services to both individuals as well as family members who are affected by schizophrenia and psychotic illnesses. And within that, through our support services, the number one question we're always asked is how do we get help? Where do we go? And it could be from both when you're just first starting to experience symptoms, or when you have been dealing with the system and the treatments for 20, 30 years, but you get stuck. So when we came up with this guide, it was really trying to address that need and trying to help people figure out, well, within Ontario, irrespective of where you live, what would be some of the central points of access or first steps that you can take to help you get connected to services and supports within the mental health system. So some of the background. Many of you probably already had experience dealing with the mental health system, and within that I'm sure you would know that it's quite complex and not easy to navigate in any way, shape, or form. There is essentially a huge lack of services and supports. There are very lengthy wait times. And on top of that, access points and eligibility vary highly depending where in the province you live, or even within where in Toronto you live. I think some people are disconnected from services, not by virtue of their needs, but by virtue of what the system is able to offer. And the final point there is no central hub of information when you can go, no 1-800 number that you can go that would tell you, based on your needs, this is where you need to go in the area where you live. So the idea behind this guide was, again, trying to address those issues from a very practical, user-friendly component. You all have a guide in your packages, so I will not go through the detailed where to go to in certain situations and provide you just a general high-level overview of some of the points of access and what their function is within the mental health system. So here we are. I will start with the stages of care. And for people who are not familiar with the mental health system, and even for some of us who are, I think it's a very crucial need to understand that there are different stages of care, and depending at which stage of care you are, your access points may vary, as well as the services that you would be connected to may vary. So essentially when somebody first starts to experience mental health issues, they go to the assessment stage. Within that stage, the clinician or another healthcare provider essentially assesses, gathers information, what are your needs, what are you experiencing? And assessment is used to inform diagnosis, which is the formal medical term for identifying what kind of mental health problem you have. Sometimes you may skip the diagnosis when you're trying to access treatment, so not everybody asks for you to have a particular diagnosis to get access to the treatments and supports. However, in my experience, it always helps if you could have, that check mark somewhere that says what condition you have, which is quite unfortunate because a lot of people don't get diagnosis or get multiple diagnoses throughout their lifespan, which essentially serve to disconnect them from services rather than connect them. Then within treatment really varies from person to person. Generally speaking, for mental health, treatment is not just the medical treatment. So it's not just the psychiatrist, it's not just the medications, it's not just the hospitals, but it really is comprehensive and holistic. So if people need informal support, such as, family, friends, colleagues. People need social determinants of health, such as social supports through housing, employment, income supports. And people need those softer community-based supports, whether it be counseling, whether it be peer support groups. And depending on the individual and where they are within their illness, where they are within their journey to recovery, it fluctuates. So at one point you may need more intensive supports, another point you may need less intensive supports. And once you complete the treatment, people usually transition into aftercare, which again, it's not the treatment, but it's that maintenance phase, which helps people transition between more of a structured formal treatment to getting back to their regular life and their regular routine. And it really includes services such sometimes case management, rehabilitation services, and depending on the organization, there may be no end in sight, or there may be a particular period you only have aftercare for 1 year, which is, in my experience, is usually the aftercare point. So, within our guide, we tried to come up with a diagram to help people navigate where they are. And it really asks a number of simple questions to help you figure out where you are. And the starting point is really, have you previously had contact with the mental health system? And it takes you through a journey, depending on whether you answer yes or no. I'm not going to go through the diagram. If you want to play around with it on your spare time, please do. It has been actually proven to be quite useful to helping people figure out where they are, where to go next in terms of their options. The comment that I did want to make on it, this is a very simplistic diagram, and at any point in time you may have arrows going to across different stages, and recovery it's cyclical. It's not that once you get to recovery you're there. You may really experience symptoms throughout your lifetime. So you may be back to previous contact with the mental health system. So I just wanted to put that in perspective. All right, so points of access. Essentially, our guide starts with crisis services, which is usually, particularly for people who are first starting to experience mental health symptoms, this is their first access point of support. And within that, we identified 4 sort of main gateways. One of them being crisis lines and distress centers. And within that, those are available throughout the province, particularly in almost all jurisdictions. They are free, most of them are anonymous, most of them are 24/7, and they're accessible. So particularly thinking for newcomers and people who may not have status, they could be a wonderful resource to get people that, support to get them through the tough time that they have in that day and time. The next step up from that is mobile crisis units. And these are usually staffed by a police officer and a mental health professionals. And these are not available in other jurisdictions. Within Toronto, I think right now we have 4 crisis support teams. And if you're trying to connect your clients, or even yourself or your relatives to it, calling 911 and specifically requesting a mobile crisis intervention team is the way to go. If you don't usually be connected with police, and the outcomes may be a little bit different. Another access point is emergency rooms. So again, this particular crisis is often needed for mental health situations. However, unless you have OHIP, you will be footing quite a significant bill after the fact. So, sometimes people may need it, but it's usually not the recommended route to go unless it's a dire emergency. And then police. I think a lot of times people don't see police as the crisis service per se. However, unfortunately, by virtue of the reality that we have where the mental health system is so broken, and by the mandate the police have, they are, most of the times, are the first responders. So anytime you call 911, police are the first to show up, and this is within their guidelines. They need to be there to assess the situation, assess the safety. And they really serve as the gateway to mental health services at that point. They have the discretion to either, assess the situation and lay charges, or they have discretion to take this individual to a hospital to bring them in for treatment and assessment. So the point I want to make there, they can also press charges, so again, being cognizant of when to call them. The next level of access points would be primary care and specialty care. So these are very basic ones, such as family doctor, walk-in clinics, community health centers. The main things within there I want to highlight is family doctors and general practitioners, whether in private practice or in family practice or in a community health center. They can treat mental illnesses essentially. They can prescribe medications, they can monitor medications. Depending on the person's situation, they may not always be the appropriate support. So they may either make referrals to psychiatrists or another level of care themselves, or you may need to be the one asking for a higher level of support and advocating at times. Within the community health centers, again, my experience has been usually these are the places to go to if you don't have health insurance. These are the places that you can connect it to health services if you're a non-status, if you did not receive your insured federal health care yet. I wouldn't put it out there that all of them do it. My experience has been in Toronto, it's pretty good. And then the specialty care would be the psychiatrist. So often the role of psychiatrist is to diagnose and to treat mental illnesses as they are described in the Diagnostic and Statistical Manual. Their role generally has been to do counseling as well. More and more we are finding that it really is within your 15-minute appointment. How are your symptoms? What are you experiencing? How's the medication working? Thank you, come again, whatever the appointment is. You could ask for more counseling, and they have the way to connect you with services. And one positive side of having a psychiatrist is when you need to make referrals to other community services, whether it's housing, whether it's case management. Unfortunately, it really is helpful to have a psychiatrist making a referral. Within the healthcare system, we still have the hierarchy of professionals, and psychiatrists kind of rank up there. So if you're able to connect with psychiatrists, at least from that perspective, it's a really good resource to you and your clients. Then it goes to inpatient and residential treatment. So this is for people, wow, I'm really running out of time. So this is for people who are really not doing well. And within inpatient, those are usually provided by specialty psychiatric hospitals. In Ontario, that would be QMH, Waypoint in Penetton, Ontario Shores in Whitby, and Royal Ottawa Hospital in Ottawa. There's also a number of Schedule I facilities which, by law, are allowed to provide inpatient services for people with mental health issues. And those you can find out on the Ministry of Health website. And there's a number of hospitals actually within Toronto that are able to provide with that. And hospitalization could be either involuntary or voluntary, depending on the person's capacity. And then for addictions, there's residential treatment. And aside from, in conjunction to the mental health services for addictions, it's voluntary. So you could not be forced to take residential addictions treatments, with an exception of unless it's within your, if you go through a drug treatment court, or if it's part of your bail or probation conditions. Those would be the only circumstances where it would be more or less mandatory. And then there's a number of community supports, such as early intervention clinics, case management, assertive community treatment teams. And the idea behind the community-based supports is really bringing the care to the individual within the community, so they do not need to go and be hospitalized, but they still would have access to a number of services and supports to help them manage their conditions. Assertive community treatment teams these are the teams that you need to be connected through, usually through the hospital, and you need to have more or less of a formal referral from a medical professional, such as either family doctor, but oftentimes a psychiatrist. The benefit of it is that once you are connected, you have a group of professionals who would visit you at your home, and you have a psychiatrist, a nurse, a social worker, a case manager, sometimes occupational therapist, a dietitian, depending on the team, coming to you at your home to give you the care that you need. There's hospital patient services, which also provide care and clinics for people when they are transitioning out of more of like intensive supports within a hospital. For addictions as withdrawal management, and I'm sorry, I'm really rushing because I'm getting the time cards, but the point for withdrawal management is for inpatient, which is for the withdrawal you can have outpatient and inpatient. For the inpatient, if you're dealing with clients who have used and abused alcohol or benzodiazepines, oftentimes you need to go the inpatient route just for the safety concerns. Usually folks like that cannot be weaned off in the community setting just because it really is very dangerous to the health and people could die. There's mental health court diversion, which unfortunately I don't have enough time to go through, but it's also out there. I'm glad to answer questions afterwards. And there's also peer supports, which is, when we think about the supports that are available, this is actually one of the most crucial ones that people could get, to speak to somebody and through what they're going through. It could really provide that camaraderie and understanding. And it has been shown to be quite effective. And there's counseling. And there's family supports, and again, informal supports. So oftentimes when people deal with mental health issues, they may not want to go through the mainstream mental health system. However, they may get the same support and services from their church pastor or from their community group. And there is huge value in those supports as well. So just thinking outside the box, those are just as valuable. So when people are looking for help, those are the options that they have within their own community, within their own lives. And then there's housing and supportive housing and safe beds. Again, the guide goes through details through those ones. Point that I want to make about supportive housing, it's really housing, which is usually rent geared to income, so you will not be paying more than 30% of your rent, but you're also connected with mental health supports as part of your housing arrangement. And they really depend and vary across the province. Some of them have in-house support, some of them work in partnership with mental health agencies who support sort of the common client, quote unquote. And level support really varies depending on the person and their needs. And safe beds are usually temporary housing arrangements for people who are experiencing a crisis, and many of them are really limited to a particular population. So for example, somebody who's just been released out of jail. 1 minute mark, okay. There's financial supports, which again, with DSB and Ontario works. And these are the central points of access. So before I wrap up, I think this is one of the most important points that I could lay through. These are mentioned in the guide. But Connects Ontario is a wonderful resource. If you haven't heard of them already, they actually let you customize the services that you're looking for based on the client that you're working with. So sort of what are the demographics characteristics, where are they located within the city or within the province, and what kind of level of support they're looking for. And Connects will provide you with a number of agencies and referrals within that catchment area, which can work with your client. Oftentimes it can also provide you with information sort of what the referral process would be. And they're both available online, where you can go and essentially almost like Google your directory in terms of which you, and they can assist you via the telephone. So again, like, I highly recommend, if you haven't heard of them already and you're looking for help, they're a wonderful resource. Through the Ministry of Health, Healthcare Connect, and Healthcare Options, again, caveat being you need to have a health card, but oftentimes if you have a client who has a health card, they are pretty good as well in helping you figure out where to go next. And then Association of Ontario Health Centres has a listing of all of the community health centres throughout the province, which lets you do a search by your postal code and tells you, once you go on the link, it tells you exactly where around you the nearest community health centre is. So quite useful resources. And I think I need to wrap up, so
Okay.
sorry guys.
Thank you, Irina.